So I'm going to give a kind of a general overview of, just like Harry said, the program update overview of our pseudorabies program, swine brucellosis program, just kind of what some of our testing numbers are. And the USDA is implementing CISS. We're doing comprehensive integrated CISS activities. So I'm going to go over some of the CISS stuff and talk about some of the emerging diseases like Dr. Sundberg talked about earlier, such as Seneca Valley virus and other things that we're working on to address the emerging diseases such as the NLRAD rule. So I'm going to start out with comprehensive integrated surveillance, and this is just to give everybody a reminder of some of these definitions, that these are the same definitions we've been using since 2013, to just kind of go over so we understand what we're looking at as comprehensive surveillance and what we have implemented as comprehensive integrated surveillance. And it is that standardized data collection that we're still working on improving the data collection side of things, that targets sample targeting and a response to multiple and evolving swine health needs. And then during the resolution in 2013, where it actually called for the updated comprehensive integrated surveillance activities on implementing surveillance through appropriate surveillance streams and results. And I emphasize that word, appropriate surveillance streams and results, because you get to that, then you get to the principles. And so when everybody worked together, and we worked with industry to come up with a lot of these principles back a long time ago, that it is that approach to animal disease surveillances that focuses on and allows the cost efficiency. So that's where we would have talked about testing samples from different that are the same risk. If they have a risk for feral swine exposure, what are the diseases feral swine can carry? Let's test those samples for that. Garbage feeders, what are the diseases that garbage feeders could get? So that sample could be utilized for multiple things to have, so that gives us cost efficiency, targeting efficiency, looking at the streams to accomplish a goal. I mean, we're doing surveillance to answer certain questions, and that's part of comprehensive integrated surveillance, is answering those questions. Doing ongoing evaluation and improvement processes that allow us to increase or decrease surveillance. This is part of comprehensive integrated surveillance. We can ramp up surveillance in certain things, or we can decrease surveillance in different avenues. And it's to flexibility to expand or contract it down, our surveillance needs based on the current surveillance needs to answer those goals. What are the goals and priorities of industry for certain diseases? And so part of pseudorabies is part of that CISS program, and we're looking at it. Our 2003 program standards still apply for our program activities side of things. We're still utilizing the 2003 program standards. Like I said in the past, we are looking at ways to improve some of our programs, and we need to answer the goals of industry. We're utilizing surveillance for rapid detection. Dr. Sundberg has mentioned in the past that the Chinese strain of pseudorabies virus is an emerging strain in China. We're doing surveillance for rapid detection, including diagnostic testing in our non-labs. That is key for finding disease. High-risk testing around feral swine and high-risk herds. Doing garbage feeding markets, garbage feeders. We're testing markets. We're doing testing on farms in many high-risk states. And a good example of this is just recently we're working on a herd right now where Wildlife Services, and this is showing our collaboration with other states and working with Wildlife Services, is they found some positive feral swine in the area. Well, the state did a testing around those positive feral swine. They hadn't found positive feral swine in this certain area of this state. And there was one herd in that area that was fairly close by that was an outdoor production transitional herd. And that herd came up positive. And that just shows kind of our collaboration of looking at high-risk testing to do rapid identification of potential herds out there. Because our feral swine still remain a risk and will always remain a risk, and we do collaborate with Wildlife Services on their feral swine disease management program to try to eliminate feral swine in some states, and that's reducing their level and reduce their damage and eliminate in certain states over time. It's a big goal that Wildlife Services has. But they do remain a disease risk on top, because 15 to 20% are positive for those that we test. Demonstration of freedom, we have our annual reports that we're still relying on, doing sow bore testing to rely on the 5%. And this is where, we need to look at some of our goals and some of our efficiencies that we're looking at to say, can we improve this? Do we still need to do that 5% anymore for a demonstration of freedom? Because that's way over testing for OIE guidelines. We're currently testing, and I'll get to the numbers here in a little bit, but that does over test what we need for demonstration of freedom on the sow bore side. And we're also, but all this testing that we're doing has, in 2015 I got there, has looked at, we did find one transitional herd in Texas last year, and that was through the high-risk testing, but not through our sow bore testing. And we are analyzing that stream for reduction opportunities into the future. Market swine surveillance, which is often called meat juice surveillance. Last year, in 2015, we tested 7,228 animals. It represents seven states, with 75% being in Iowa. It primarily targets just the healthy animals. It's again utilized for demonstration of freedom. It's to demonstrate disease freedom. It's not effective stream for rapid detection of any disease because it's looking at serology. When you look at the science behind it, you're using serology. So they've had to have it. You're slaughtering healthy animals, so these are all recovered animals. Where did we find PEDV first? We found it in the diagnostic labs. So we're looking at ceasing this activity, and we can reestablish as a need emerges using science-based approaches to utilize. This goes back to CISS. We use science and our knowledge of certain streams to expand and contract to use them where we need to use them for the purpose that we're trying to solve. And so we're looking at ceasing this activity right now. FY15 testing data for pseudorabies. You notice our diagnostic laboratories. We tested 27,000 swine from 3,002 herds. Cull sow bore, 210,000 samples were tested. Feral swine, 3,000 samples, and market swine there for a total of 248,000 samples. And that did find that one transitional herd last year out of Texas through the high-risk testing through our diagnostic laboratories and known labs. Swine brucellosis, another component of CISS. We still utilize the UMNR. We're testing 5%, just like with pseudorabies on there. Very similar to pseudorabies in many ways for similar risk where people can get swine brucellosis from. We are currently analyzing our programs. The folks in Fort Collins with USDA CIA are analyzing our swine surveillance activities right now, including swine brucellosis, and looking at ways to improve the surveillance side of swine brucellosis for us. For testing in FY15, we tested 210,000 sows for swine brucellosis and 3,000 feral swine again, and we identified 2 transitional herds in FY15 that had swine brucellosis. So we still do see it. Just recently, I'm working on a herd right now that has been identified that we've had a couple this year for swine brucellosis just in FY16 so far. One in the west and one in the east where they both had swine brucellosis. One of them was identified because the human had swine brucellosis, and then we tested the herd and found it that way. But we are, and that one's ongoing right now. We're still doing the epi, and we just got notification of that the other day. So we still see swine brucellosis, but again, it's in those transitional type herds. They've all been transitional, not in the commercial herds. And I want to emphasize, we're not finding it pseudorabies or swine brucellosis in commercial herds.
What do you mean by transition?
Herds that have exposure or potential exposure to feral swine. Swine Health Protection Act, to give you a program update here. And I noticed, Terry, there was a resolution on the Swine Health Protection Act, and I think that regulation update was done in 2010 or 11, I think, on that resolution. So I don't know if that resolution is absolutely needed anymore. We can talk about that afterwards. But we are doing inspections. and we work with our state partners on Swine Health Protection Act inspections, including utilizing states. We utilize public health and do those investigations where we may have potential illegal activities going on. In FY15, we did 27,000 searches for non-licensed feeders. There are 10,369 licensed premises still in the U.S. and its territories. Puerto Rico has a lot yet. We found 44 non-licensed feeders out of that. 531 new licenses were issued in FY15 for the swine health protection, so there's still a lot of people using alternative sources of feed for swine. And as you know, we've seen a lot of the articles lately about all the garbage that goes to the landfills and stuff that is food waste, and so we are seeing some increase in this in certain areas. A lot more questions coming in on how can we use this stuff versus sending it to the landfill to repurpose the food. We did 4,000 inspection checks last year and did 642 temperature checks. And we do find violations here and there. A lot of times we work on getting those corrected and work with the producers, and they're great educational moments for a lot of folks as we work on those.
So Troy, what's involved with the inspection that doesn't include temperature check? When you did 4,000 and something inspections, but only 642 temperature checks, what do they do during that inspection?
Some of those inspections include paperwork inspections. They go out and look for feed. Is there feed stored correctly? You know, look at the swine themselves, and they do look at the facilities, look at the feed, look at the way they're making sure that they're licensed. So it can involve the whole parameter versus just the temperature checks. And I'm assuming some of that is a recording issue at the same time, because when they're out there, they might not have been cooking at the time that they're out there to do the inspection on the temperatures. So they have to be actively cooking when the investigator shows up to do the check.
Well, it seems like that would be a critical part of the inspection. The temperature is the whole, that's the whole game.
Yeah, but I understand. You're absolutely right. Temperature check is absolutely critical. But if they're not cooking at the time, and if you give them a heads up that, hey, we're going to be here to do a temperature check on this day, they know they're going to get up the temperature. So we do some spot checks. And so a lot of these inspections of licensed premises might be spot checks. And they might not have been cooking at the time. You might have showed up in the afternoon, but yet they cooked at 8 o'clock in the morning and done. So you're going to have some variation in there. So a lot of them are at the actual time that they showed up, they were cooking, they could check the temperature at that time. But that's a lot, that makes sense to you.
Yeah, but do you know how many violations in 15?
Not off the top of my head, no. No, not off the top of my head. I can get that information, but I don't have that.
Is that posted on the website or something?
No, it's not posted. No. So CFS, classical swine fever surveillance, is a very important part of our current CISS surveillance activities. We do collect high-risk samples from designated states, such as collecting samples of tonsils and swabs from high-risk swine that are found in slaughter, high-risk swine that have symptoms of classical swine fever collected from diagnostic labs. As we go out and do the garbage feeder swine, all of our inspectors are trained to look for signs of CSF and any other foreign animal disease. And if there's dead pigs or suspicions of signs of foreign animal diseases, we start a foreign animal disease investigation. We also take samples at the time, including if there's dead pigs there, we'll just do random surveillance for tonsils and tissues and submit them in. And we also try to educate all of our garbage feeders that classical swine fever, African swine fever, FMD can all be spread by undercooked garbage activities. And to give you an update of our surveillance activities for classical swine fever, diagnostic laboratories is an important part of our classical swine fever surveillance. There again, if we're going to see disease, it'll probably be seen at the diagnostic labs first. So we did 2,900 samples in FY15. High-risk slaughter swine, we did 2,500 samples. Feral swine, we're testing feral swine in high-risk areas, especially around landfills and other areas. Garbage feeders again. States where there's a lot of import of products. We're testing feral swine in for CSF, and we do domestic swine with a high probability of CSF, and that includes some of our slaughter, includes our domestic swine population. So we have over 12,000 samples, all negative, and we're, again, with CIA, folks in CIA are also evaluating all of our surveillance activities on the swine side, and to understand if we're meeting the goals that we need to meet to answer industry's questions. As mentioned earlier with the PEDV virus, we did revise, to give you a quick update on PEDV, we did revise the federal order on January 4th, and that was due to assist the program, to make the program last longer so we could support industry's needs and do continue testing as long as we could. So the revision was done to where we eliminated the biosecurity payments and eliminated the payments for the herd plan with the purpose of trying to get the funding to last longer. There's only so much money in the pot, and we can only do so much. So with the priority of doing more testing, to get that money to last longer so we could do more testing, we eliminated the biosecurity side payments. Even though that is eliminated, our DRO, disease reporting officer verifications, so our vet services, we're still contacting the producers when we find those positives. Reporting is still mandatory and required by the federal order. We still contact the veterinarians to get that information necessary for the reporting aspect of things. And that remains on track to track the disease trends so we can provide that information to industry on what's going on the APHIS side of things. All that data is entered into EMERS. So like I said, there's only so much funding, and it is planned to be exhausted by the end of this month. So diagnostic testing will be done, and after that point, producers will be responsible, and the veterinarian submitting the samples for all the fees associated with PEDV testing. Reporting will still be required, and we're going to work with industry, including Dr. Sundberg, with Schick, and Harry, and ASV to discuss how the program should continue on into the future, and what kind of requirements should stay on this program after that funding has lapsed. So, and those discussions are ongoing, and my supervisor and Dr. McCluskey have been on the task force group where they've been discussing future plans and keeping abreast of the funding situation as we go forward. So, like I said, with all of our programs, we have to look at the amount of funds that we have and the priorities that we want to get done. Just like Dr. Clifford meant this morning, we do a good job of getting everything done, but we only have so much money for all the testing, all the activities that are required of us. So right now, SECD is planning the funds to be exhausted by April of this year. And this is just kind of a map right now of our current map that gets submitted every week to show the recent trends since the federal order came in place in 2014. And the trend is going down right now. Of course, we're getting into the spring months and the warmer weather, so it'll continue to follow that trend down, we hope. And so that's just kind of an update there. Now I'm going to switch gears a little bit and talk about influenza and swine, and I'm giving this talk on behalf of Dr. Kasari, who does a lot with influenza and our influenza reporting aspects of things. And we want to start out with a disease disclaimer there, that data disclaimer that this is passive data, that it's hard to make when it's anonymous data that's voluntarily submitted to you, that we can't necessarily measure prevalence because we don't know exactly where they're coming from or what region they're coming. We know the region they're coming from, but we can't exactly measure the prevalence because we don't know all the data behind the herds that they're coming from. And so it gets hard to make certain assumptions that the U.S., you can't say the U.S. has this in this area or this in that area. So we have to look at that there's no major disease by time, location, or subtype. And we are collecting data on the state level data, and we do have summaries, but we do not disclose those summaries to anyone beyond the state stakeholders. So if Paul wanted something for Wisconsin, we could only give Paul his data for Wisconsin. He would have to contact his AD of the state, Dr. Petersburg, and then he could get that information from Wisconsin. But Paul could not get the data for Minnesota, even though if he requested it, because we only provide that data to the state partners for data purposes to keep that there. And to give you an update of what's kind of going on with influenza surveillance, and we've seen a huge increase. Let me try using this pointer here. We've seen a huge increase in the number of sample submissions. So because you can't see the lines in the back, this top line is the number of accessions, and then it's got the line going through it. This track the trend line. So that's the number of accessions. This green line here, the next one down, is our positive accessions. The next line is the red line. That's the subtypes accessions, and then your virus isolation positives are down here. This drop down right here is just due to the data lag. So that we haven't dropped off on testing right here as it shows on that. That's just due to a data lag. So that's on every map, just due to we're a couple months behind on getting the data in due to the testing and getting all the reports generated. So that's why that's there. But what this has shown is we've seen a huge increase in the number of samples submitted, but yet our increase of positives is remaining the same. And what this is doing is I'll get into it later, is like I mentioned earlier, there's only so much money, and we're utilizing our influenza testing, going through it at a pace faster than expected, due to the fact that we've had so many more submissions, which is great. We're doing more testing out there, but we're seeing the negatives. And I just want to reassure everybody that we need to emphasize that they need to be sending samples in for the surveillance if they're truly showing clinical signs of disease. Are they truly coughing sick pigs, or are we just checking the box because it's a free test? And those are questions we need to ask as practitioners and ask our members or everybody to make sure that try to get this to last as long as we can, because we are testing a lot more negative samples. And this is a heat map of our breakdown of influenza testing. And so if you can't see on the side, read the heat map here, you have your H3s up to here, and then this H1s here. So there's A, B, C, D, E in the human variant. And then we have our H1, the pandemic strain that was 2009, and we got our gamma deltas and the different H1s. Then on the bottom you have our N1s that we've identified. And this is all of the 856 viruses that have been subtyped since the beginning of the program. And then what it does is it breaks it down into a different percentage of what all the different viruses type by subtype that we find in the swine herd. So if you're looking for the human side of the H3, that's the N2. We've had 2.1% of the viruses found so far have had that human gene. Or the pandemic virus, 1.41% have had the N1 H1 pandemic strain. And then maybe it reassorted and you got the N1 pandemic with the H1 gamma, and you got 0.12% of the viruses are there. So this is a breakdown of the different viruses, but the majority are classical H1 gamma, N1 classical, so 34% there, or the H1N2 at 22%, or the H3A N2, so our H3N2 at 17%. And then it breaks on down to the different types up there. Excuse me. And something that we've been watching closely recently is if you look up here, is this human variant, where we had the 0.35 under N1 classical and the N2 at 2% here. And to break the H3s out, cluster by month since October 14, we're watching a lot of this human isolate. And it was Amy Vincent with ARS found it, I think in 2014 last year, in October 2014 is when she first found it. And we've been in it, and at that time we found it, and it was in samples in just a couple states. And we've been watching it since now. Now we've been able to identify that it's moved to 7 states. So we're watching that human variant of the H1N1 virus and how it's moving around, and it's taken a lot of interest right now due to the potential public health implications of that. And you can see this gray is the percent of the H variants by month that we're finding that are the human variants out of that H clusters. And like I said, it's currently identified in 7 states, and it's something of interest that we're watching. That shows one of the benefits that we have out of the influenza program. This map is kind of just as you look at the influenza data to give you a breakdown and information on how we break it out by regions when we do the reports, and to show you the number of swine in each one of these regions. So when we do the reports, we worked with industry and our VS partners and states to come up with districts and regions to look at, try to keep the data as anonymous as we could, and yet define certain areas. So you have region 2 and 1 are the 2 primary regions that contain most of swine. And this number here, 40 million swine, is a number that's located in region 2, and region 1 is 11 million swine. So remember that when I go to the next maps, and you'll see the disparity of why region 2 has so much more sampling and testing going on in that region. Well, that's because there's 40 million swine versus 1 million in region 5. So that's why when we get to this map, you see that there's very little testing and going on in region 5 that we have data for, but yet there's a lot of testing data in region 2 and region 1 that we have a lot more swine in. So this map is just kind of a breakdown of that by the regions. So you can see that, and it also breaks down by the different virus types. So H1N1, H1N2, H3. So the red is H1N1, the orange is H1N2. This the off-white here is H3N1, and then the light blue, and then is H3N2, and the dark blue is a mixed infection that could be multiple infections that we found. So this kind of give you a breakdown of what we're seeing in the various regions, and the reason this for FY15 quarter 4, it's back due to that exact same data lag that we seen on that chart earlier where the graph went down. It's due to our data lag, so that data's not in yet. So you can track the number of flu samples and the findings of flu by region here, by time, by quarter, and all this information is posted on our website. That our quarterly reports are on there, or are available under the Swine Health Monitoring Surveillance. So when you do the Google search, make sure you do Swine Health Monitoring Surveillance to identify this information. But it is posted on our web, and it's under our APHIS website, Animal Health, Swine Health Surveillance. But Google Swine Health Monitoring Surveillance, and that way you can identify it, find our swine flu's information. This is another graph just showing more breakdown of FY15 data by the region this time and the number of samples submitted. So you had 14,000 samples submitted in region 2, and then the number of positives by each disease here. So they give you the percent at the bottom. So that's kind of a breakdown of where we are. So FY15, we had 27,000 samples total submitted in FY15, and 3,027 of them are positive. So what I'd like to stress on this slide is out of this presentation here, out of all these samples submitted, most of them are negative again, and so we really need the 36.9% are the ones that are matrix positive. So we really need to look at, and we're going to be working with industry on this to try to develop new guidelines and maybe new algorithm to try to help address the number of samples that we're testing that come out to be negative positive, matrix positive. So maybe we can utilize our funding better. Because right now, 36% are negative, and out of those 36%, 27% we actually find virus on that we can subtype. So that's kind of what this is. The importance of this slide is showing that out of these 27,000, we only found disease in VI matrix positive in 3,000 of them, and out of those 3,000, we only found virus in 840 of them. So it's kind of giving you a breakdown of what we could actually subtype and go from there. And there's been questions in the past when we had the high path AI outbreak in birds of do we have a surveillance plan that will find disease in other than our the ones that we're looking for, the H3s and 1s in swine? And the answer to that is yes. That matrix looks for any influenza. And so here's kind of an interesting finding that we found in December of this year, where a herd in a Midwestern state submitted samples for influenza testing in swine, and it came up matrix positive. So we know it had an avian Influenza A type virus there. It was matrix positive, but yet when the lab subtyped it to try to find the H1 or H3, it was negative, but yet we had the matrix positive. So what's going on there? So they sent the samples to NVSL, and they did a gene sequence for all the avian genes in there. And what we found was H4N6, and it was a herd, feral to wean herd in Missouri, and the reason we know it was Missouri is because they actually selected it as a traceable sample, which allowed us to do the traceback on it. If it wasn't a traceable sample, we would not know any more than just we had a H4N6 identification in the U.S. And so this was a good thing that they selected it as a traceable sample, but they actually had some sick gilts that aborted, other pigs were coughing, but they were PERS negative, so that's why they submitted the samples. And it came back as H4N6, but just to point out that that is not a high path or low path virus. That's not our H5s or H7s. But it is a very common influenza that's found in wild birds. And so since we did know where the farm was, we could actually do the epi on it and get back and take additional samples, answer a lot of questions to get more information on that. And the evidence is lacking that virus that is persisting in that herd. There's not any evidence right now that can support or deny that. So that's lacking to support that. But that's kind of showing some of the importance of our H4 of our influenza surveillance program. And with that, we did an internal review on our influenza program this year. It was a review done by our program analysis department. So it was a review done by within USDA, but yet a non-biased group within USDA, because it was a totally different group, to look at what we're doing. Are we meeting stakeholder results? Are we looking at getting the results and meeting stakeholder needs? Are we analyzing due to changes and transitioning into? And they did provide good information for us. They told us that that there are some areas where we can continue to enhance and improve the program, including enhancing communication transparency, focusing on our resources, efficiencies. There again, we're going to have that meeting here coming up. Improve our data management, which is kind of USDA wide on our data management side of things for APHIS, and build on existing stakeholder networks. So we are continually to work on this and utilize these goals out of this internal review. But they did find that we were meeting or partially meeting at least 8 of the 9 goals and objectives. So we are trying to support stakeholder needs and give stakeholders the information they need for influenza. We also did an external review that looked at the technical and scientific merit of the program, and he recommended a lot of the efficiencies too, including provided 26 recommendations on the program as it is, or what to do, and provide recommendations and a revised program due to budget limitations, and gave us 9 priorities for action identified. And the summaries of these reviews are actually posted on that same website as before. We posted the summaries of these reviews on the exact same website that I just showed you earlier, that their quarterly reports are at. Just right below it a little bit, the program assessments are there. And they're right here. the executive summaries of those reviews are there, so that way they're out there for everyone to see and can comment on. But we do have to talk about influenza and the funding side of things. Like Dr. Clifford mentioned this morning, we can only do so much, and our current influenza funding is projected to last through FY16, but funding beyond that is uncertain right now. And so with it being uncertain, we have to work to identify those budgetary resources within our program funds, which are also just a limited pot, to continue those surveillance activities into the future. And so collaboration meetings with industry are beginning, and I think there's a meeting planned, was it May 13th or something? 15th? 18th? To reassess the program goals and futures and try to help us identify industry's needs and priorities so we can look at trying to make this funding last as long as we can before we dive into program funding and utilize that funding to make the program last. So there's a lot of questions we need to answer that I don't have the answers to on the funding side of things, because a lot of it deals with the number of samples coming in, number being tested, how we're going to change the algorithm. We can't give you, it is uncertain whether we can make that funding last longer or not. Surveillance, just give you an update on our ASF FMD pilot. It was done in FY14 and through 15. The number of samples that we expected to get versus the number of samples we did get were hampered by our HiPath AI deployments. You know, May, June, July last year, August is when we were going to try to get a lot of the samples for the ASF FMD pilot. And everybody in VS was busy with HiPath AI. And it didn't matter who you are, where you were at, everybody was affected by it. And so we didn't get quite the number of samples that we expected, but we did get enough samples coming in to know that it was a successful identifying certain issues that we have to correct. And a lot of it, like I said earlier, is data. And there are certain things. A data group has been put together that Dr. McCluskey is leading to identify and try to solve some of these data issues that we have. So right now, the ASF FMD pilot is on hold until those issues are fully addressed and identified. But that brings up the question again: is how much, our current surveillance that we're doing, our passive surveillance, is effective in demonstrating freedom for trade purposes. So that would be for rapid detection to try to identify those. And that's where the FADD investigations come in. We utilize the practitioners on that. I'd like to go a little bit over Seneca Valley virus, or Seneca virus A in swine. With this disease, it looks like FMD, it acts like FMD. You cannot differentiate it from FMD. So my main point of this slide here is if you see any Seneca Valley virus, just because you have Seneca Valley virus in the herd doesn't mean you also don't have FMD in the herd. And we need to stay vigilant and try not to become complacent to say, oh, that's Seneca Valley. Anytime we see a vesicle or anything that looks like FMD, we need to be reporting that. And our role as a USDA is to rule out that it is not FMD, and then go from there. This summer we did a lot of investigations in the Midwest. It started showing up in I'd say August, September area. We started seeing a lot of Seneca Valley virus start showing up. We're still seeing it at a lower number, and there's talks that it's very similar to the Brazil strain. This is some of the findings that we've seen when we've done FAD investigations on swine, just to show how similar it can look to FMD. You see blisters on the nose, vesicles. You can see vesicles under feet, bilateral necrosis, a sloughing hoof walls here. You can see the hoof walls are painful. You can see a lot of lameness in some of these pigs. In some herds, you might see it up to a large percentage of the herds are infected. Other times we've gone in and seen very few of them have blisters. But either way, you have to investigate it as an FAD investigation until an FAD is ruled out, and just to make sure it's not FMD. So reporting, mandatory reporting is very important here to protect our industry. We did issue a guidance document in October. It's still in effect until replaced, and we worked with industry in November and working on a revised version of that to clarify and streamline, and it's made it through all of our levels. It's at the deputy administrator's level to be signed, and we fully expect that to be out very shortly here. I would say within the next week or two it'll be out, definitely. And that guidance document incorporated a lot of the basically clarified a lot of the issues that came up in the first version that came out. Still, with all of it, we still rely on foreign animal disease investigations. Treat anytime you see a vesicular disease, report it to your AD. It is an important thing to get out. If Seneca Valley is confirmed in the area, we can submit them at lower priority, but we still need to submit them for an FAD investigation. Talks about sending samples to non and FADO. Remember, guidance documents are for our people and how to instruct everything to go on in the field. Testing priorities can be elevated depending on the results of the non-labs, and this guidance document also reinforces that we're not paying. The USDA is only paying for FMD, as that's our concern, to rule out foreign animal diseases, and if it is Seneca Valley virus, that would have to be done by the practitioners themselves or the producers. To finish this presentation up, talk a little bit about the National Reportable Disease. Dana Cole and Sia and Stan Bruntz out in Fort Collins are working hard on the NLRAD rule. And if you haven't heard of NLRAD, it's designed to be a single uniform science-based list of all diseases that states and industry and everyone has worked together on to come up with that national list of reportable animal diseases. And its purpose, so it'll help streamline things. It'll provide a consistent reporting process. It'll facilitate international reporting obligations when we report to OIE. When Dr. Bruntz reports to OIE and Michael David, it facilitates that at meetings and stuff. It supports our export certifications for when you sign exports. We'll have that standardized reporting mechanism for diseases. Contribute to our assessment and response of emerging and endemic diseases, and facilitate response to any type of emerging disease in the U.S. And we're working with all industry and all stakeholders in this, as it's just not a certain industry group. We have all the different industry groups together that we're working in collaboration with. We're working with the states, working with the laboratories to move this forward, and they developed different concept papers, and they got after the concept papers we have different working groups, including the confidentiality side, our data management side, how do we roll it out, updates, implementation. So we have different working groups that that are assisting with the rollout of NLRAD, and that information from them working groups is expected. The implementation plan of it is expected to be released for public review prior to USHA. So sometime, hopefully in September, October, we have that released before the USHA meetings for public review. And with that, we're also working with stakeholders on drafting input on emerging disease framework and trying to do an EPI reform that looks at a generic approach to address all commodities, whether, if we had Seneca Valley virus in cattle or something else, how do we address doing an EPI framework, a generic approach to address all those commodities. And right now we're collaborating with SHIC and National Pork Board and others on that epidemiological investigation, and we're also setting on many of the SHIC's working groups to help address some of these emerging diseases that are out there to make sure we address industry's needs.